As a Friday night bonus, we are just going to look at the basic components of a blood gas. We need to know our pH, our carbon dioxide, our bicarbonate, our base deficit, and our oxygen. When we look at the pH, this is going to vary based on how old your baby is. That can be in hours and in weeks. Smaller micropremature babies may have pHs as low as 7.25, and that would still be considered normal, where some of our older babies may actually have pHs up to 7.40 when they are chronic and have older lungs. When we think of our CO2, yes, we do like to talk about it being, between 35, 40, 45, 50. But honestly, everywhere I've worked, we have done permissive hypercapnia and accepted CO2s up to about 60. When we talk about our bicarbonate, really we are thinking that we want that to be between, 19 and 26 or 22 and 26. In general, the bicarbonate level is going to tell us a lot about what's going on with compensation and when our baby is in a real not great spot. Our base deficit tells us more of a chronic picture. We use this with HIE to tell us how long the baby had been affected by their in utero event. So anywhere, when we talk about HIE, we say if the base deficit is more than -12, that we are concerned. This number can also tell us how well the baby is compensating. And then, of course, we're going to look at our oxygen. Our oxygen really is dependent on where we're drawing our blood from and how well the baby is perfusing. So keep that in mind. Our capillary oxygen levels are always going to be lower and different than our arterials. Keep in mind when you are drawing these labs what we want to be doing. We want to make sure that we take note of the mode of ventilation, the CO2 levels, the oxygen level, and the baby's saturations. If we're drawing a capillary blood gas, make sure you have warmed the heel and that the baby has adequate perfusion. Join me tomorrow. We're going to dive into this more. I promise there's more exciting things to come.